Hello and welcome back to Soul Star Radio. I'm Jacquelene Close Moore, your host, and I've got our resident Dr. Anthony back with us, joining us today. Now, I get a lot of this from clients and friends, and they say, oh look, I went to the physiotherapist and I had some acupuncture, and I say, was that a Chinese doctor? I don't know, my acupuncturist. I said, now was that dry needling or acupuncture, and they sort of don't really know the difference. So can you tell me what is the difference?
Sure. Basically, I'll pair it right back to the training first and we'll work our way up from there. So as an acupuncturist, I've done 5 years full-time university training, 27 hours a week. I spent and 2 trips to China. The first 2 years of that course, we're in a classroom and we practice acupuncture techniques on each other before we even see a patient. I reckon I went through about 1,000 needles before I was able to do the skill of insertion that I do today. Physiotherapists, chiropractors, PTs, you call them in America, myotherapists, they do a weekend workshop. They get sent a small manual about the basics behind acupuncture. I know, unreal, isn't it? And they do.
Is that like 20 hours? I've heard it's like 20 hours of training or something.
Wouldn't even be 20. If it's 20, they're overworked, yeah. And all they do is on a Saturday, they turn up to a weekend workshop to go, this is how you put a needle in, they get a certificate and they get sent on their way. There wouldn't even be 8 hours of training in the whole thing. It's a huge concern here in Australia, and I understand the fights on in America about dry needling and acupuncture. I follow it on Facebook. I've got a lot of acupuncture friends in America. There's a lot of countries that have banned it. I know Canada's bagging it because of the lung collapse of one of the Canadian gold medalists. And the biggest problem we have with dry needling is pneumothorax. Now, we're trained probably the first 4 years. We do a lot of anatomy work. We all know the lung comes right up to here. I've seen dry needlers go straight through that, cause pneumothorax on the spot. I watched a video the other day of a chiropractor training dry needling. He caused a double pneumothorax right before our eyes. It's available on YouTube. It's one of the most disgusting needling techniques I've ever seen. So basically the difference between a dry needler and an acupuncturist is total lack of training and total lack of understanding of what they're doing. That I get them in my clinic. I forbid them, once I take them on as a patient, not to see anyone doing dry needling because I don't want my work undone. The other common thing I hear from them, Jacqueline, about someone that's experienced dry needling as opposed to acupuncture is the pain. They say it's the most painful thing they've ever had done to them. One patient who had been treating a while went to a chiro, had dry needling on her knee, and she said it was the most painful thing I've ever had done. I stopped halfway through and said, have you ever felt one of my needles? She said, not one. I go, well, why are you going? They're untrained. They don't know what they're doing. They can cause a lot of damage. There's a huge difference. They don't back up the principles of acupuncture on we do through our 12 meridians, 365 acupuncture points on my little man here. I don't needle all of them, by the way. I needle most of them. They will just say, you're sore here. They'll shove a needle in. They'll stimulate it like that. Then they'll rip it out.
When they're I've seen it on video with them stimulating the needle and going like this, which seemed really weird to me.
Yes.
What's that doing on an acupuncturist sort of view or level?
Actually destroying the point. What they're doing is going in like that. They're wiggling the needle around. The needle inside the muscles is scratching the muscle to bits inside, hence the pain. You don't do that.
No.
We twirl,
Yep.
We go in and out, we flick, we scrape. They go in and out like this and twist it around. That is so bad. They end up with bruises like this. It needs to be stopped, that dry needling front.
So I understand, like, when you're learning to do needles in the first place, you taught about angles and which directions and things like that.
And depth as well. So of 365 points, every point has a different depth. And as a trained acupuncturist, I need to know what's the depth of that point there compared to that point there, compared to that point there, compared to that point there. They will just shove it in, pull it out. There's no way in the world as an acupuncturist we just shove it into a muscle. We treat the body. We're holistic treaters, so we treat the body as a whole, mind, body and soul. They just treat the muscle and off you go. I have more results by treating a whole body. Even your patients laugh at me. I'm only in for my knee. Why am I getting one here? Because I'm calming your mind, my friend. Why am I got them in my hands? It's my knee. It's the pain relief point, large intestine 4. Why are they in my feet? I've got a sore knee. Because we're pulling the chi away from the pain part. We're working on these 12 meridians. We have a complete understanding of what the body does when we hit the large intestine meridian, the gallbladder meridian. They don't have no belief of that. They just shove it in. We do 1,000 hours of training before I even see a patient. Then when I see my first patient, when I'm allowed out on the public, or they let us out of a classroom after spending thousands of hours in a room practicing, we're under super strict supervision. I'm in with a year level above me and a clinic supervisor in the room at all times. You do nothing but observe for the first few months. You're still needling in the classroom, you're still keeping your hand in, and then they release you into the public in a clinic student clinic area of the RMIT University. You are still under supervision, you still have a clinician in the room, and you still have a supervisor watching you.
Cool.
It's not until we get up to fifth year, so I've had 4 years of full-on training. In my fifth year, they actually step back and allow you to blossom as an acupuncturist because you've passed all the skills test. We are constantly tested every 6 weeks. We have a practical exam about insertion, location, distal, and knowing what the needle's all about.
And what sort of training, after you've done all that training, you're out practicing with the public, what sort of oversight is there, or what sort of, do you go back and do other modules? Is there further learning?
Absolutely. As part of our federal government registration, we have to have 20 hours of continual professional education. 4 of that is ethics, so 16 of that must be skill-based. So every year I do over 20 hours of training, and I choose, like I chose fertility last year. I've become a bit of a specialist in the field. I've got a very good success rate with fertility. So I've studied that. Then I did 5 elements the year before. That was 76 hours of training outside my clinic hours. So I easily do my 20 hours every year. Easy.
And have you had any weird experiences with doing acupuncture on patients at all?
I've had quite a few, actually. You'd probably be the number one.
We might as well tell them about that one.
I did it's known in 5 elements world as possession treatment. It's when our thoughts are not here. Their body's here, but their mind's not. There's a distance between the two, and you can pick it up. Often it can be relationship caused, it can be evil caused, it can be a patient is just not focused and not earthed. And it's a series of points we do down the body and then in the hand. And of course, unusual experiences. I'll actually put up the photo. It's called Releasing the Dragons. 32.
I do love my dragons.
Yeah. Oh, yeah. I noticed.
That's a bit too much.
When I was needling stomach 41 left hand side, there's a sequence into doing this. This dragon came out of Jacqueline's foot and bit me on the hand.
Look, why not?
And why not? It was a beautiful dragon, typical Chinese style dragon.
But the great thing is I like to provide evidence.
Even my 5 element instructor was very impressed. The fact that we saw this dragon bite my hand. And I had to describe what the dragon looked like. It was a Chinese style dragon.
Fabulous. So was your university lecturer impressed by that?
He was over the moon about
there
that.
You go.
It took me probably 2 months before I could tell him because I kind of felt a little bit embarrassed.
A little bit, yeah.
A little bit. Mate, I'm seeing dragons spooky in my room. But no, it was good.
Like everything's normal, don't take me away in a white coat. That would have taken guts to tell him about.
Oh, yes. Yeah, it did take me a while, and I kind of did it quietly in the corner. But there was 30 in the class, and they go, what? And I had to show the photo and send it around the room. They were quite impressed with the result.
There you go. Acupuncture works.
Yeah, it
on
does.
many levels.
And on another front, needles not going into a body.
Oh, yes.
I've seen that happen before.
So that was the 7 dragons, that was the needles going onto your body that weren't there via the dragon.
Excuse me, yeah.
And then we've had needles that don't go in.
That bounce, literally bounce. Now, I've got a very good insertion technique. My insertion technique is totally pain-free. Even my 4-year-olds that I treat will tell you that. They do not feel anything. Putting a needle into someone, not pointing at anyone. The needle bounced out. I thought, what's going on here? Did it again. Must be my technique.
It's called free will.
Yeah, it's called no longer required. That point was not required. Yeah, that point wasn't required.
Yes.
I can't remember the point exactly at the top of my head now, but it was not. That was not there for you.
No, I don't think I can. I sort of contain myself to normal conventions.
I wouldn't put you in that box either.
So we may well show our people how a needle is
yeah,
done.
for sure.
Don't try this at home though.
I've
need
just
a few thousand hours for that.
You do. Don't go and buy them at the local store and do this.
And I'm just going to show you it's not painful.
Yeah. So I've just got it. It's an oversized needle for what I want to do. The reason I've got this 50mm out is so it'll actually stand out on camera for you. So
considering I used to be terrified of needles, this is a very good thing.
So what we're going to do is get Jacqueline to put her arm up here. I'm just going to Sanjiao 5, just up here on the wrist. This one here, it's a very good point for use for carpal tunnel or any hand conditions. Australian federal government changed the rules last year about swabbing. We no longer have to swab prior to insertion of a needle. I'm old school, I swabbed.
I think it's better.
Absolutely. Everyone has pathogens on their skin.
It reminds you something's about to happen too.
Correct. And we all have pathogens on the skin, and the last thing you want me to do is add a pathogen. All right, so I've got a needle with a guide tube. I use guide tubes, a lot of acupuncturists don't. So we're just going in here, Sanjiao 5, hold the tube, we go tap, the needle's in, and we go to the correct depth.
Did I flinch? No.
Did she flinch?
No flinching.
No.
There you go.
And then, I don't know if it's coming up on camera or whether you can see it. There we go, it's leaning over now.
There we go.
And that's basically how we do it. A common question I get asked is how many needles do I use per patient? The answer to that's actually variable because, I can use as little as 3, I can use 4, I could use 30. Our theory is more is not less, less is not more. Well, it's not about throwing as many darts at the dartboard and hoping one hits the dart, one hits the bullseyes, which is the theory behind dry needling. They just keep throwing them at. I've had a local dry needler tell me they used 90 needles on one patient. 90.
Oh, but they had oxygen tanks as well, but that's
Yes,
another story.
That's another story, yes, because the
Just in
patient
case you're
actually
blacking out.
blacked out. So yeah, less is best. So and because we do bilateral treatments, we're repeating a treatment on one side of the body to the other. So when we're saying 18 needles, in my world I'm only using 9. We're just repeating. There are the Dr. Tan's theory which throws that out. It's 2 on this meridian, 2 on this meridian, 2 on this meridian. So they'll invoke about 8 meridians doing that way. They're the treatments I use for long-standing conditions or people under the wellbeing banner who just want to come in for wellbeing.
So, I've got a Chinese guide, Li ShiZhen, who's always in a hurry apparently because his time is precious. And whenever he visits me, he always bangs one acupuncture point. Has there ever been such a thing as one-point acupuncture at all?
Yeah, absolutely. When I was in Beijing in 2011, I studied lung conditions and single-point acupuncture. And there was a belief system over there that one single acupuncture point can cure everything in the world, and that is stomach 36 down beside the knee.
Ah, that's the one point he hasn't hit me on.
Yeah, so he's a bit more wise than me, so he'll probably know a lot more than what I would.
I think he's also trying to teach me the points by making me literally remember them.
Yes, a bit of pain behind the point is a good way to remember it, apparently. Not in my clinic.
Not in your clinic, but possibly 1,000 years ago.
Oh, absolutely, yes. The techniques are quite different then to what we do today, and the needles they were using them are not what's available today. It was more like sharpened bone and not the beautiful steel needles that are available to acupuncturists as we
Today.
speak.
Thank God for that. So there you go. If you're thinking of acupuncture and you're terrified of needles, don't worry, we're not using the ones from 1,000 years ago.
Correct.
Thank you so much for joining us on
My
Soft
pleasure.
Radio. There, Dr. Anthony. We'll catch you next time.
Thank you for having me. Bye.